Ladies and gentlemen, it's very warm and welcome and greeting and for all of you. This is वरहर, chairman of Guticho Rural Municipality, and speaking from Corona Hospital here in Chunikhel, Kathmandu. I have been just appeared on social media by bringing a very specific issue, and after winning the last time election. Today I am going to talk about the health and problem of my son. The issue is quite in public, it's quite relevant and useful for entire society, but it has been related with my family member. My son had a Hydatid cyst. This is a story of 3 years back. My son was studying at Rona International Boarding School here in Baniatar, Kathmandu. One day he fell on the ground of his school and started vomiting. The school administrator came and immediately took him at the emergency ward of the teaching hospital. The doctor immediately quickly did sonography and ultrasound, and finally it was found a Hydatid cyst in the right lobe of his liver. So doctor insisted was to carry out the operation and as soon as possible. We are planning, but unfortunately the global community, including our country, faced an unexpected pandemic like coronavirus. So we couldn't be able to do operation in that time. So in the second phase of the coronavirus, beginning of the second phase of the coronavirus, the doctor made the plan to carry out the operation of Hydatid cyst of my son. So we came in Kathmandu, and finally doctor order was to test COVID status of my son. Finally he was tested COVID positive. So doctor's teams again cancelled the plan of operation of Hydatid cyst of my son. Finally we back to Jumla because the society has been normal, and after the chronic pandemic of the coronavirus, the government of Nepal declared the local level election. We joined in local level election. We get somehow success, and finally we brought new policies and programs and budget of new fiscal year, and through the general and convention of Guticho Rural Municipality, and just 1 week back our entire family back to Kathmandu and met again Dr. Dinesh Koirala, his entire team at the pediatric department of the teaching hospital. And the doctor again did sonography, and at the same time CECT and contrast enhancing and computing tomography also, because that was a technique where it reads medical teams and more closer to analyze the exact situation of the cyst. It was found an almost 11 centimeter cyst in the right side of the liver. So doctor teams immediately made plan to carry out the operation. We were thinking to carry out operation at teaching hospital. Unfortunately, teaching is the biggest hospital, and there is a huge flow of the patient across the country, and so there is a pending of lots of cases. So there is no possibility to carry out quickly operation of the Hydatid cyst of my son. So we agreed to carry out operations here in Corona Hospital, Chunikhel and Kathmandu. The 5 days back, and along with the entire family, we arrived at this hospital, and since then my son's hospitalized. The doctor's teams did an operation of that case. Before the operations, the doctor teams was making plan to do laparoscopy surgery, but they attempted to do laparoscopy surgery, but it could not be possible because of the large size of the cyst, and finally doctor team did open surgery and removed completely Hydatid cyst from his abdomen and from his liver. Actually, what is the cyst and what is the Hydatid cyst? The cyst is like a sac, and it can be filled in its structure. It can be filled with liquid and gaseous and semi-solid and solid and others and materials. It can be from any part of the world. Actually, cyst is a different types of the cyst, because the ovarian cyst is ganglion cyst and Backer cyst and pilar cyst and macular cyst and breast cyst and Hydatid cyst. The cyst can cause because of different reasons. Basically, the cyst maybe happens due to the tumor, maybe happens due to the genetic conditions, and maybe happens and fault in an organ, and default in cells, and actually in chronic inflammatory, and cyst happens, and actually in parasite because of cyst happens. And I already talked on Hydatid cyst. Hydatid cyst mainly happens and due to the parasite blockage of the detox, and any injuries that blockage the vessels, that also can happen in the cyst. So what is exactly the Hydatid cyst? The Hydatid cyst is a common parasite and cause and larval and stage of Echinococcus and granulosus, because this is happens due to the tapeworm that caused by carnivorous animals, for example fox, dogs, and camels, and shark, and etc. Because the idea is that because that kinds of carnivorous animals and release some kinds of egg on the grassland, on the soil, and on the any part of the topography, and when the human being and naked hen and interact with the grassland and on the soil, infested and infected and by the eggs of the carnivorous, and then that's if you don't sanitize in proper hands, that enters into the mouth and especially goes to the intestine, and through the intestine it goes to liver and other part of the human body. This is a way of transmitting an Hydatid cyst and from the grassland to a human being. Another way, and probably when the carnivorous and animals, dogs and fox, and release and the eggs, that's the eggs and remains on this grassland and up to 1 month. So probably when it interact with the cattle, especially goat and sheep, finally that goes into the intestine of the sheep and goats, that is infected in sheep and goat. When you take the meat of infected sheep and goats and other cattle, according to the scientists and especially according to the doctor, the Hydatid cyst actually happens, 70% happens on the liver, and remaining 50% happens in the lungs, and remaining 10% in other part of the body. And while talking about the Hydatid cyst happens in 3 layers. The first layer is called pericyst, and second layer called centrocyst, and final layer we call an endocyst. The endocyst has been covered by an brood capsule, we call an sac capsule or brood capsule, because according to the Dr. Dinesh Koirala, and how did he carry out the operation, as per his understanding, because he did operation of the 3 types of the cyst, pericyst and centrocyst and hydrocyst, because he tried to separate an endocyst and with and brood capsule and separate from the centrocyst and pericyst, and finally they separated the endocyst, and he used the injections to extract and such kinds of liquid and such kinds of other watery and inside the brood capsule, and remained a wrinkled brood capsule, and he extracted and from the medical equipment and surgery equipment. This is how the operation happens. So this is a very and serious problem and health problem occurring, and especially poor and sanitized area, because we have lots of preventing measures and controlling measures and from the Hydatid cyst, because first we have to the periodic deworming of the dog, and we have to do if you want to save, and if you want to save from the Hydatid cyst and avoid and some sorts of Hydatid disease. And apart from that, and we have to improve the sanitation especially in the slaughtering center, and we have to do cooling of the elder sheep, and at the same time deworming of the free roaming and dog and stray dogs, and we have lots of dogs because of that it happens. And apart from that, and we have to focus on proper sanitization, proper hand washing, and at the same time we should be always and far from the domestic and carnivorous, because we should not much love with them, because they may be infected, they may be infested, so that's why we can get that problem. So anyway, it was very difficult problem for my son. Not only it was a very pathetic situation, our entire family was facing the problem. The day before, just few days back, the doctors teams and did a successful operation here in and Corona Hospital in Chonikhel. So my son and has been very happy right now. Our entire family of also and have been very happy in this very crisis time, because we have got lots of support and from different people, and some of the, I think, and special we would like to thanks and Dr. Dinesh Koirala and his entire team and Professor Dr. Gehraj Dahal also, because they use and maximum and I think medical skills and medical technique in order to remove and this kinds of, and I think the Hydatid cyst and from my son, because of their skill, because of their extraordinary work, my son, our entire family has been much delighted. So special thanks for them. And apart from that, and we got some financial support in this very crisis time and from the Jumla, because there is our acting chairman of Guthisar Rural Municipality, Mr. Tikadatta Neupane, and sent a certain amount of money. Our an IT officer and Prem Sai also sent a certain amount of money. Our accountant Jairaj Kumai also sent and submit a certain amount of money. And apart from that, our storekeeper Motiraj Jaisi also sent a certain amount of money in order to carry out this operation. So they provided financial support in this crisis time. So it's our special thanks and for them also. Apart from that, the number of people called and on my mobile phone in order to understand the exact and health condition of my son, especially our respected and esteemed uncle and former, I think, Constitution Assembly member, Mr. Alolijang Sai, and called number of time on my mobile and showed the concern, the health condition of my wife and as well as son. So I think our thanks and also goes to the Alolijang Sai also. And apart from that, our brother Tirtha Bahadur Buddha, who is a former, I think, district and president of Jumla, and now he's a central committee member of Nepal's Unified and Communist Party, and he also called a number of times. And apart from that, and our relatives came and at hospital and observed all those things. Finally, I would like to thank the hospital team also, because a very nice and hospital team, because even director of the Corona Hospital and visited my son and talked with me and talked to the patients, and they provided the entire team, especially nurses and doctors, and provided and proper love and care and support and over that case. So we got very homely environment and at the hospital. So while staying up to 1 week at the hospital, because we didn't feel and such kinds of any stigma and discriminations and from the hospital management committee, and they treated in a very human way, very dignity way, and very I think decency way. They show it in a high level of respect over us. That's why thank you all of us who directly, indirectly and touch with our family in this crisis time. Thank you very much.